Good evening. I'm Karen Jones, Executive Director of the wAIHA Warriors, and welcome to our Q3 webinar all about open enrollment. We have an interesting presentation planned. If you have questions, you can put them in the chat and we'll ask them at the end. Our speakers tonight include James Romano from Care and Cure Partners and our very own wAIHA Warriors Legislative Coordinator. He'll begin tonight with a brief Insurance 101 presentation, then return to answer questions later. Rebecca Dawson is the Client Services Operations Manager at Good Days. She has been with the organization for almost 13 years and is highly experienced in medical claims processing, marketplace insurance enrollments, and business analytics. Rebecca is a problem solver who enjoys helping clients afford their treatments. And finally, Renee Jamil. She may or may not make it, we're not sure, but if she does, it'll be great. She's a wAIHA Warriors patient advisor and secretary to the board of directors. She'll be answering some questions at the end of the presentations, but if she doesn't make it, I'll go ahead and do that. So thank you everybody for joining us, and welcome. Jim, you can go ahead and take us and get us going.
Well, thank you everybody. Sorry about that problem, but I'm here tonight to talk to you about some just to give you a quick Insurance 101 before we move into Rebecca. So thank you very much. Some key insurance terms that like everybody to understand. Obviously first, what your like health insurance premium is. That is the monthly amount you pay for your coverage. When you obtain your coverage, sometimes your employer pays a percentage and you pay a percentage. Sometimes you're paying 100% if it's for Medicare, any kind of Medicare supplemental or Part D plans. Another term that is deductible. That is the amount that you have to pay before satisfying, right off the bat. So if you have a large treatment, you have a $2,000 deductible, you have to pay that before the plan kicks in to pay a certain amount of, a percentage of the dollars. There's another terminology we use is copayment. Copayment is a dollar number when you that you pay on a prescription drug or a doctor's office visit. You have a fixed dollar amount. So it can be $25, it can be $50, it can be $250. But and then the terminology coinsurance is a percentage of that, the cost. So a lot of people say it's synonymous, copayment, coinsurance. We're actually two different things. One's a fixed dollar amount and one is a percentage. So I know there's a lot of coinsurance when it comes to very expensive treatments. You're paying sometimes, additional 20% coinsurance or 40% coinsurance. So that's a difference. An out-of-pocket maximum. That is the amount that once you pay, you don't pay another dime. So if it's a $700,000 out-of-pocket maximum, once you hit that, then the plan picks up 100% of the costs. Up to then, you're sharing costs, or you're paying 100% out of pocket. Another terminology is explanation of benefits. That is a document that you receive from your insurance provider regarding any kind of costs from a hospital or such. Why is it or your doctor's office or the emergency room? Why is it important knowing this information? Well, if our health coverage, health literacy in this country is very low, and knowing these key terms will help you navigate in picking the right plan for you, which Rebecca's going to be talking about these open enrollment periods. Can we go to the next slide, please? So I just want to talk about types of coverage real quick. The most popular type of coverage in the United States is employer-sponsored insurance. So we get most of our coverage through our employers. And then we can break that down into self-insured plans and non-self-insured plans. Well, what does that mean? Well, there are plans that basically the company pays all of your costs, and those are self-insured plans. So they have a third-party person who runs that, but they pay for all of your costs. Whereas some other have a fixed defined benefit program, and that's what non-ERISA plans are. ERISA plans, it's also on who is basically oversight for these plans. ERISA is the Department of Labor. Non-ERISA is your state insurance commissioner. There are other individual plans. There's the marketplace where the exchanges are. Ever since Obamacare started, I always thought the marketplace or was this exotic place like you're in Istanbul or Marrakesh or something. You can get your, genie lamp or, flying carpet. But no, the marketplace is where you actually can pick a policy, and Rebecca's going to be talking about that later. There's another plan that you'd want to really be knowledgeable of, and that's COBRA. COBRA was established in 1986. It allowed you to take your insurance with you if you're at an employer of above 50 employees, but you're responsible for 102% of the premium. So if you leave your employer and you can COBRA, but then you're responsible to pay the whole premium plus a 2% administrative fee. There are other types of coverage. Most of that is there's some individual plans. And so those are basically your private insurance market. The public insurance coverage, and it's very important to distinguish whether you're in private or public because of being able to accept patient assistance or other and those type of things. You have Medicare A, B, C, and D. Once you turn 65, you age into the Medicare program. Or if you're somehow disabled, you need to go for 2 years without working to be able to qualify for Medicare if you're accepted as in the disabled program. Everybody gets Medicare Part A, that's your hospitalization. They pay for 80% of your costs, you're responsible for 20%. You could get a supplemental policy through Medicare Part B, which actually then allows you to pay some of picks up the costs. Infusion therapies, cancer therapies. There's Medicare Part C, which is Medicare Advantage. That's a whole different entity. And then you have Medicare Part D for dog, a very popular program that's prescription drug coverage for senior citizens and those on Medicare. There's also Medicaid. A lot of people get confused. Medicaid is a state and federal partnership that allows for individuals, if they're poor or under a certain percentage of the federal poverty level, close to 133%, to obtain coverage in certain states. There's also S-CHIP, which is the Children's Health Insurance Program, which provides coverage to children under 18. There's TRICARE, which is the government system for our military. For when you retire, there's the VA system. And then if you're a member of one of our Native American tribes, there's the Indian Health Service. And that's just a quick terms and types of coverage. Here's my information if you have any questions about what I talked about, and I'll turn it back over to Karen.
So next up, we have Rebecca Dawson.
Okay, perfect. All right, we'll go on. So like we said earlier, I am with Good Day. So this is just a little bit more about our organization, just to kind of give you a snapshot. So we are a patient advocacy organization, and to date, we have assisted just over 800,000 people and counting. Increases every day. We're pretty proud of this next number, but 93% of every dollar that we receive donated to us actually goes directly back to our patient assistance programs, helping us provide near instant access to medications and treatments for those patients, which is awesome. And then, of course, looking out over the span of how long we've been an organization, we've actually assisted with a little bit over 2 million grants. And of course, that's increasing every day as well. So Now, as we kind of jump into some insurance things, so a few timelines to kind of keep in mind for you as you're looking for plans. The first is to kind of determine which bucket, for lack of a better term, you may fall into. So the first one I've got notated up on the screen is for commercial patients. Really, those are plans that are not government funded in any way. Okay, so employer-based plans are considered commercial in some way, but typically will have their own open enrollment time period that your HR department will know about. But if you have a commercial plan through the marketplace that you have selected on your own and have no form of Medicare or anything like that, you're gonna go with these timelines for open enrollment. So open enrollment will start on November 1st. And then that will run through December 15th for plans to start and take effect on January 1st. The open enrollment period for commercial plans actually ends on January 15th, but if you enroll after December 15th, unfortunately your plan would not take effect until February 1st if you get that enrolled and active. The second bucket to look at would be Medicare. So if you have any form of Medicare coverage, you would fall into the Medicare open enrollment period. So that would be looking at those Medicare replacement plans, those Medicare Part D plans, anything like that to get that additional coverage. You're going to have a little bit of a different time frame. Open enrollment for Medicare patients actually starts on October 15th and runs through December 7th. And that's kind of a hard cutoff. And of course, that would be for plans to take effect on January 1st as well. Okay, so for plan enrollment, the best place to go and look at your plan coverage options is really just to go to healthcare.gov and then get coverage, /get coverage. This is going to walk you through a few steps and ask for additional information in regards to your demographics. It will ask for an estimate of your household income and different things along those lines. And it'll actually give you results to tell you some plans that you actually are eligible for in your area. If you have Medicare, it will walk you through that step and provide information on how to look at additional plans that way. And if you don't, it'll walk you through the different options for commercial plans as well. And that's kind of what is referred to as the marketplace. So if you ever hear anybody say, go to the marketplace, that's going to be your starting point or the best place to go. For any information, if you do have an employer-based plan, the best place to go is to talk directly to your HR department. They should have all of that information for you. If for some reason they don't, another option is just to call the insurance plan directly. They will then be able to answer most of those questions for you as well. Right, and then I put together just a few helpful tips for you as you are looking at plans that come up as options to figure out which one may be best for you and your family. First is while reviewing those plan options, make sure to look at the costs that are associated with that, including some of those terms that Jim talked about. So that monthly premium amount is how much you're going to be paying every month for that coverage. But then on top of that, you'll have your deductible and your out-of-pocket max or total out-of-pocket. All of these costs you will be responsible for, so it's important to keep that in mind when you're selecting what might fit best. Next is to always have a list of your doctors and medications ready so that you can ensure that everything that you need covered is covered or on formulary. Sometimes you're going to look at plans that your doctor is covered, but your medication isn't. So having that list readily available for you will make it a little bit easier going through that research process. Okay, when you're looking through that, most of the plan details are going to be able to be found online. So if you're tech savvy, you can jump online and find that information pretty easily. But if not, or if you have additional questions, always call the insurance company directly and they can generally provide more details for you.
Thank you so much, Rebecca and Jim. That was really informative. Next, we have some questions. Danae hasn't made it quite yet, I don't think, but that's okay because I have the questions here as well. So the first one is, and both of you, I think, mentioned about speaking to HR with your company or someone at the insurance company. Can you give us a little bit of information about, and I don't know, this is probably Jim because it has to do with the insurance, but can you give us a little bit of an idea of what kinds of things that we should be taking note of while we're having the conversation?
Well, I think that when you're there meeting with your HR department, to make sure that you're sharing, what your situation is, and what you're looking for in a plan when you're talking with your HR department. I think, and I think prior to them, picking a plan, having some kind of input from the patient is good. Whether they take it or not, it's two different things. I always say I had a great relationship with the HR department at my former company, where I could go in and have those conversations.
And document everything
Yeah,
in a phone conversation.
absolutely. Yeah. When you're talking with an insurance company, though, make sure, I cannot emphasize this enough, make sure you take down their name, phone number. And so, because I always love when I get somebody calls me and says, oh, I'm having this emergency, and they do not, oh, I don't know, I forget who I talked to. Well, then it's, at least if you have, like, a lot of these insurance companies tape their phone calls. So if you have a person's name, then we can find out if there's a problem, what's going on.
Yes, and a lot of those calls for insurance companies, they'll also have what they call a reference number for that call. So notating the time, date and time you called and who you spoke with, and then ask for every single time the reference number for that call. And that would just be another record that they can pull.
Good to know. That's great. And it always seems more seamless if you are able to get directly to the person that you spoke to the last time that you had to talk to them. So can someone talk to us a little bit about co-payment accumulator and any other kinds of restrictions that we should be aware of?
Yeah, those co-pay accumulators are tricky that they've kind of gone into place over the past few years. The biggest thing is to always ask if that plan has one in place. Essentially what a co-pay accumulator is going to do is if you have any type of co-pay assistance program, unfortunately, whatever that co-pay assistance program pays out towards the cost of your treatment or your medication is not applied to your deductible or your out-of-pocket. So you're going into it thinking that whatever they are assisting you with is paying towards your out-of-pocket or your deductible. But unfortunately, if they have a co-pay accumulator in place, after that may run out, if that funding runs out, you're then still responsible for your total out-of-pocket or deductible, and you haven't made any headway towards it. So the biggest thing to ask going into it is just if they have that in place. There are some states, if I'm not mistaken, that have prevented those from being in place. So definitely you can look and see if your state is listed on that, that prevents those. But there are still quite a few that it could be in place and affect that greatly.
And this is where knowing if you have a state plan or an ERISA plan, a self-insured plan, is very important. If you have an ERISA plan, a lot of people, and Rebecca said right, a lot of states have banned the process for states that are plans that are regulated in that state. So, as an example, is on Texas. Texas has passed legislation that ban copay accumulators. However, if you're at a company in Texas that's a self-insured plan, that doesn't apply because it's very important that you know what type of plan you have. Being ignorant of the process because you don't like paperwork, or that's not an excuse, and it's going to generate very little sympathy from the insurance company.
Mm-hmm. Good to know. That is good to know. So I, like a lot of people who have had a rare disease or currently have a rare disease, have a lot of different specialists. So how is it that I can figure out, and not only specialists, but also medication. So how is it that I go about figuring out if my variety of specialists are covered in my insurance plan, and also if they're covered in the pharmacy program?
So a lot of that information can be found online. So when you're going through using that healthcare.gov or the marketplace and doing the research to find out what plans you are eligible for or may be eligible for, you'll be able to compare all of the different plans. And typically what will happen is there will be what they call a formulary or an in-network, their network. So those are kind of go hand in hand. Your network that they're talking about is usually in relation to their doctors that are covered. So you want to have that list of your doctors readily available for you. So you know, okay, I need to make sure Dr. Smith is located on, in network for this insurance plan. Now with that, with our program, what we have actually kind of found in our investigation on our side is that we have to take it one step further than that as well to make sure that the doctor's office then accepts that plan. So we've actually had some patients that have enrolled on, let's just say, I'm going to throw it out there as a United Healthcare plan, that when we do the research, it shows that that doctor is in network, but that doctor's office has decided to no longer accept that plan for them specifically. So just making sure that you make sure it's in network through the insurance website. You'll pull up that. You generally speaking, if you type in your doctor's name and maybe the zip code, it'll tell you if they're in network or not. It's pretty simple. But then past that, if you selected a plan, giving that doctor's office a call just to say, hey, I'm trying to enroll for this type of plan, this United Healthcare Gold plan. Is this a plan that your office will accept? And go from there. And it's very similar with your medications. If you're needing those covered as well, you're going to want to make sure that those are on formulary.
Good, thank you. Let's see. So wAIHA doesn't have an approved treatment yet, but CAD patients do. And so one of the questions that we have is, what do they, or what can they do if they don't have, if they can't afford their premium?
So that's an excellent question. There is a patient assistance organization that offers premium and cost sharing assistance for CAD patients. And so what I would recommend they do is to reach out to the CAD Foundation, and they will be forwarded, I'm sure, to the assistance program. Hopefully, when there is a treatment for wAIHA, that we will be, similarly have patient assistance programs offered for the treatment and for the disorder, and so that we'll have premium assistance and cost sharing assistance. So right now, it's just for CAD patients, but as we keep moving forward to approval for a treatment for wAIHA, that's something that we will be keeping our eye on. But right now, there's a program out there for CAD patients. So I would have them contact contact us, and we can provide them with that information.
Great. That's great. Those are all the questions that I have. Does anyone on screen have any questions, or is there anything else you'd like to tell us about, Rebecca or Jim?
Everybody's I think that a lot of information, good information, has been given,
Yeah.
And I hope that wAIHA patients will watch this video, and it's on our website, and to really understand the open enrollment period and take advantage of it to obtain good coverage.
Yes. Yes. Well, thank you everyone for coming tonight, and thank you so much, Rebecca and Jim. And we appreciate your time and the information that you've shared with us. Thank you.